My job number one in this state is to keep people safe. Clear, simple. There's no way to cloud that. There's no gray area. I need to keep people in this state safe. And we'll be nation leading with our mandate, which strikes at midnight tonight, when everyone is expected in a hospital in the state of New York or a healthcare facility to have been vaccinated. We are hit the first, we're hit the hardest, and I want to be the first to say we're over this. And so I'm calling on all the healthcare workers. First of all, those of you who've been vaccinated, I thank you from the bottom of my heart for doing what was right and helping lead the way so we do have the confidence we need. And to those who've not yet made that decision, please do the right thing. And to all the other healthcare workers who are vaccinated, they also deserve to know that the people they're working with will not get them sick. Today is a significant deadline. It reflects my priority to just stop this virus dead in its tracks. We are over it. We are done. We want to move on. And the only way we can do that is to ensure that everyone is vaccinated, but particularly individuals who are taking care of the people who are sick.
Is that what she says? Is that what she says? Yeah. I don't think she has, our best interests at heart. That's what I think. We're living in strange times, man. Really dire, hard times. That's what I think. We're living in some really, really harsh times. Because you have police officers quitting because they won't take the jab. And now you got healthcare workers that are, leaving their job or being fired. And it's sad because without the health responders and without the police, New York is in trouble. Well, New York, I don't know about the police in New York. I don't think so. I think a lot of them are taking the jab. But in other states, they are quitting. But still, these hospitals, they need staff. They need numbers to take care of the people who are injured. Okay, they need proper staff to take care of what happens in the hospital daily, every night, 24 hours, 365 days a year. And this is a really dumb move because you need able-bodied people who are capable to do their job. Hospitals in New York State suspend or fired scores of workers Tuesday after they refused to comply with the state's new mandate of healthcare employees to be vaccinated for coronavirus, officials said Tuesday. St. Barnabas Hospital in the Bronx reported that 98 workers, mostly in its housekeeping and nursing divisions, failed to show proof of getting a COVID-19 shot. The number had dropped from 140 employees earlier Monday, an indication that the workers now realize the edict to get vaccinated or get fired. Israel and many are complying at the last minute to keep their jobs. The nearly 100 employees are suspended without pay and have up until next week to show proof or face termination, a St. Barnabas spokesperson said. St. Barnabas has about 3,000 employees. We can manage, said hospital rep Steve Clark. Yeah, right. At Richmond University Hospital in Staten Island, a sizable 10% of employees were still unvaccinated as of Tuesday, spokesman said. Richmond Hospital has about 2,500 employees, so a 10% refusal rate equates to 250 workers. We have 90% of our staff vaccinated. We also have no staffing issues and continue to provide the full spectrum of health care services for the Staten Island community and surrounding areas, said Richmond Hospital spokesman Alex Lutz. The guillotine continues to fall at Northwell Health, the state's largest medical network, which runs Lenox Hill, Long Island, Jewish, LIJ, Forest Hills, and Staten Island University Hospital in the city. Northwell has 76,000 employees. The hospital behemoth did not provide precise numbers on Tuesday, but even 1% non-compliance rate translates to 760 workers. Northwell Health on Monday announced it already terminated dozens of anti-vax managers. We have begun a process to exit all unvaccinated team members using a carefully planned approach that both maintains continuality of care at all of our facilities and ensures the safety of all our patients, a spokesman said in a statement. Northwell regrets losing any employee under such circumstances, but as healthcare professionals and members of the largest healthcare provider in the state, we understand our unique responsibility to protect the health of our patients and each other. We owe it to our staff, our patients, and the communities we serve to be 100% vaccinated against COVID-19. The Big Apple's public hospital system, the Health and Hospitals Corporation, refused to provide a comprehensive tally of how many employees were sent home Monday because of their refusal to comply with Governor Kathy Hochul's order, which required all hospital and nursing staff to get their first shot of the COVID vaccination by September 27th. The system's chief, Dr. Mitch Katz, told reporters during Mayor Bill de Blasio's daily press conference that the system had brought on about 500 nurses to sub for those who could not longer work. We anticipated that there would be some loss of staff. We knew that no matter what our efforts, some people were not going to get vaccinated. We planned appropriately, Katz said. When pressed for additional details, a spokeswoman would only say that more than 90% of its 43,000 strong staff had met the deadline. Other Brooklyn hospitals that reported vaccination rates of under 70% of the state health department last week, Interfaith, Brookdale, and Wyckoff, had no immediate comment. Officials at Long Island's SUNY Stony Brook University Hospital said 134 unvaccinated employees are being suspended without pay and on track to meet with our labor relations representative to discuss the next steps. Employees will have to use vacation on holiday time off, officials said. The state-run hospital employs 7,400 workers. Meanwhile, a SUNY spokeswoman refused to provide the total number of employees stated to be suspended and on track to be terminated at other state-run hospitals, including Downstate Medical Center and Upstate Medical Center. To date, nearly 94% of our healthcare professionals are vaccinated with at least one dose. Our hospitals are in contact with the unvaccinated staff members to work with them to get their vaccine, said SUNY spokeswoman Holly Leapis. Per the state order, our hospitals have suspended and have begun the removal process of those unvaccinated employees without exemptions. And in the meantime, our hospitals are managing service and delivery, making adjustments to the schedules and managing elective surgeries as necessary to continue to care for our patients, she added. Upstate hospitals are also confronting anti-vax workers. Albany Medical Center reports that 204 employees are not vaccinated and face dismissal. The hospital in the capital region employs 11,456 workers. But with the sword of Damocles hanging over their heads, there's been an 11th hour surge of laggard workers getting their COVID shot, hospitals officials said. I don't have the numbers of people let go, but I do know that our hospitals saw a significant surge yesterday in healthcare workers getting their jab before the midnight deadline, said Brian Conway, a spokesman for the Greater New York Hospital Association. Governor Kathy Hochul signed an executive order Monday night to address staffing shortages at medical facilities. The state health department will oversee 24/7 operation centers, and National Guard medics, retirees, and out-of-state and foreign nurses could be deployed. Really? Wow. Maybe that's what they want. The only way we can move past this pandemic is to ensure that every eligible worker is gotten the jab, and that includes those who are taking care of our vulnerable family members and loved ones, Hochul said. Preliminary self-report data shows 92% of the hospital staff statewide were vaccinated as of Monday evening, Hochul said. The percentage of nurses home staffing receiving at least one COVID vaccine dose increased 92% as of Monday evening, up from 70% on August 15th, before the jab mandate was announced, according to hospital department data, the governor said. The state health department, which runs 4 nursing homes for military veterans and the Helen Hayes Hospital for Rehabilitation, said facilities are adequately staffed. The St. Albans Veteran Nursing Home in Queens has 326 staff members, and 17 had not gotten their first jab. I don't know, man. I really think that, this is way overkill. I think that, this is something that doesn't have to be done. This shouldn't be done, because you could get this jab and you can still catch it. So it doesn't make any sense. I mean, I personally think that, people should have the right to choose whether they want to get the jab or not. If you have pre-existing conditions that, you need it, then fine. And if you have pre-existing conditions that you shouldn't get it, then don't get it, if advised by a doctor. Okay, but this is really, they're forcing it on you now. And this isn't right. I mean, you're causing people to be homeless. You already have more homeless people in New York City now than ever. And the funny thing is, you know what? But you're bringing in immigrants here too. So this is going to start a whole type of war in America. Immigrants versus people who are already in this country and they need jobs, and you're giving it to them. That's what's coming. And mind you, these are the people from Afghanistan who have a culture. And I just told you I did this live stream about how 2 of them were arrested on base for molesting minors and assaulting their wife. Okay. And you're bringing people over with this type of culture into America, who come from a culture where it's normal to do that. It's normal to molest kids and stuff. And they will be seeking a job, possibly in the health field. And you have your kids coming to these hospitals. They will be wanting to work in the health field. I'm not against anybody from the Middle East. But what I'm trying to tell you is that you're kicking people out, making them homeless, and you're bringing another culture that it is okay to harm women and children. Anybody see a problem with this? New York is going down the tubes fast, as it is, and it's just going further. At the upstate-based Oxford Veterans Home in Chenango County near Birmingham, 31 of the 351 staff members have not been jabbed. No services or activities have been curtailed. We continue to strongly encourage all unvaccinated staff, all healthcare facilities, to get vaccinated as soon as possible to protect our most vulnerable populations and to comply with the state's mandate and the impeding federal mandate, said DOH spokesman Jill Montagne. Several lawsuits have been filed to scuttle the vaccine mandate. A federal judge issued a temporary restraining order barring employers from denying workers religious exemptions tied to the state's mandate in response to a religious freedom lawsuit filed by 17 healthcare workers, the majority Catholic, against Hochul, the DOA, and Attorney General Letitia James. Hochul, however, has argued that the state constitution does not allow for religious exemptions. Utica Judge David Hurd has until October 12th to make the final decision. That's not true. We have freedom of speech and freedom of religion. Okay, so yeah, you see, there's more deeper to this than just trying to say we're trying to keep you healthy. That's what I see right here. Okay, that's what I see right here. This right here is there's so much more to this than meets the eye. Okay, there's so much more to this, and you all see it too. You all see it. You're all not dumb. Okay, some of you in different countries, you see what's going on, especially in Australia. Don't let me talk about Australia. Australia is basically it's Nazi Germany. That's all I could tell you. Let's see what this Facebook user said. It's all about compliance. I like topics you come up with, bro. Yeah, man. Thanks so much for appreciating the titles I come up with. I try to be original. I try not to follow the trend. Sometimes I do if I like the topic, but sometimes I like to come up with my own stuff. I have my own mind, and that's just basically it. That's what I try to do. If you want to come up, you could come up if you want, man. Let me send a link. You want to talk about this? I have a lot more since I finally got the kinks working with Podbean, so I will be talking about a lot more stuff. Stuff that I can't talk about on YouTube because YouTube, you know how it is. They'll come for you. They really start the purge, man. They be starting to purge. They ain't playing. But this is all I got to say for now, and that's it, really. All right. So, like, share, comment, and subscribe, and to stay prepared. That's all I could tell you, because we are in for a lot of hard times. Okay, like, share, comment, and subscribe. Get those likes up, and share the content. If you like donating to the Cash App, feel free. All right, later.